Anusol cream is used to treat minor pain, itching, swelling, and discomfort caused by hemorrhoids and other problems of the anal area, such as anal fissures, itching. Generic name HYDROCORTISONE ACETATE. HYDROCORTISONE is a corticosteroid that reduces redness, itching, and swelling. Indications. Anusol ointment can be used on both external and internal piles. Hemorrhoids. It can help to relieve the irritation caused by piles, soothing sore and correct skin. It can also be used to help with itching around the back passage and for the discomfort of anal fissure. How to use. Use this product exactly as instructed by a doctor. It will also help if you will read first the inpatient information leaflet that comes with the medication package. Before using this medication, clean first the affected area with mild soap and water. Make sure to rinse the area well, then pat it dry. You can apply this product inside the anus by using the applicator tip or nozzle, according to the instructions in the product package or as directed by a doctor. You can start by filling the applicator tip with Anusol from its container as directed. When the applicator is filled up, you can gently insert it inside the anus and apply the cream in and around the anal opening. Do not insert a finger or any part of the container into the anus. Do not insert the tip of the applicator more than 1/2 to 1 inch inside. Do not use a finger when applying the medication inside the anus. Discard after using a single-use tube and applicator if you are using this type. When applying this product to the inside of the anus, you can use a finger to apply a small amount of cream or ointment to the affected area and rub it gently. Unless directed by a doctor, do not cover the area applied with the product with plastic or waterproof bandages. Doing so may increase the absorption of the medication for the skin. While it may improve how the medicine works, it may also increase the risk of side effects. Thoroughly wash your hands immediately after applying the product. Avoid getting the medicine in your eyes, nose, ears, or mouth. In the event of accidental application in these areas, rinse the area immediately with clean water. Use this product 2 to 4 times daily or after each bowel movement or as directed by a doctor. Regular use of this medication will allow you to get the most benefit from it. Use the medication at the same time as each day to help you remember that you have to apply it. Don't use more of the product, use it more often or for longer than what is prescribed by a doctor. If you have been using Anusol in high doses or for a long time, do not stop using it without the approval of your doctor. Some conditions may get worse when the use of this medicine is stopped suddenly. Your doctor may ask you to gradually decrease your dose. Contraindications. You shouldn't take Anusol cream if you are allergic to any of the active ingredients or even the secondary ingredients, as this may cause hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Get emergency medical help if you are experiencing any of these symptoms. You should consult a doctor before using this medication if you are pregnant. There is a risk of overdose, so you should be extremely careful with the amount of cream you use when the condition is internal. Precautions. Before you start using Anusol, inform a doctor if you are allergic to hydrocortisone, any of the inactive ingredients of this medicine, or if you have other allergies. If you have been using corticosteroid medication for a long time, the use of Anusol may make it difficult for your body to respond to the physical stress. Inform your healthcare professionals that have been using corticosteroid before an emergency treatment or surgical procedure. Side effects. The common sound effects when using Anusol cream include application site reaction, rectal pain, burning, itching, irritation, dryness and redness, acne, changes in menstrual periods, increased sweating, increased facial or body hair growth, inflammation of hair follicles, lightening of skin color, allergic skin rash, secondary infection, and increased hunger. The less common side effects of Anusol cream include a hormone disorder where the body produces high level of cortisol, called Cushing's syndrome, decreased function of the adrenal gland, and nausea. The potentially rare side effects of Anusol cream include a condition where there is excess sugar in the urine, a disease with shrinking and weak muscles called myopathy, a wall in the intestine, abnormal liver function tests, an enlarged liver, and also from too much stomach acid, delirium, fluid in the lungs, glaucoma, hallucinations, high blood pressure, high blood sugar, impaired wound healing, overexcitement, paranoia, personality disorders, slow heartbeat, swelling in the abdomen, water retention, euphoria, depression, dizziness and sleep disorder,